my bacteria that I did is called Borrelia burgdorferi. And some basic facts about this bacteria is that it is the main causative agent of Lyme disease, and the shape of this bacteria is called a spirochete, which is basically a helical shape or like a coil-like shape. And it has an inner membrane, an outer membrane, and the cell wall is flexible. This bacteria is neither gram-negative nor gram-positive, even though it may have a few characteristics of a weak gram-negative stain, but it is overall neither stain, and it can infect small mammals, birds, lizards, and other types of animals, but ticks are the only organisms that can infect a human being. So basically, the Borrelia burgdorferi bacteria goes inside a small animal, and then from there, when the tick bites the small animal, it goes inside the tick, and then when the tick bites the human being, it goes inside the human, and it spreads throughout the rest of the body. So some basic facts about Lyme disease. It starts with a tick bite, and then it is called the great imitator because it is very hard to diagnose, and this is because the symptoms of this disease mimics over 300 different types of illnesses, so it's really hard to tell if you actually have Lyme disease or not. So for example, this disease mimics diseases such as multiple sclerosis and Lou Gehrig's disease, and if it is misdiagnosed or if it is left untreated, it can spread throughout your body and go to the rest of your body parts such as your nervous system or your joints, and this can potentially end up being fatal. So Lyme disease concentration, basically it is most common in the United States and in Europe, but it is found in more than 60 different countries. And in the United States, this disease is most common in the northeast area or in the north central area states right here. And there's about 3,000 cases reported per year of Lyme disease. However, the actual number of people with Lyme disease is about 300,000 because many of them go unreported or misdiagnosed because it is really hard to tell whether or not you actually have Lyme disease. The types of people who are at risk, basically there's a wide range of ages that can be affected by Lyme disease. It can go from children all the way to elderly, but the most is mostly seen in children and some older adults, but the people who are at the most risk is people who are more involved in outdoor activities such as biking or hiking or going into the woods and stuff, because this area is where ticks like to thrive the most in. If you are near wooded areas or bushy areas with tall grasses, then those areas are at high risk, and these include people such as campers, firefighters, or park rangers. And people who are outdoors are at a higher risk than the rest of the community. Some signs and symptoms of Lyme disease. So early on, some symptoms that can be shown are headaches, joint aches, and fatigue. And then some early signs would be if you have a high fever, if you start getting chills, or the most common sign of Lyme disease is called erythema migrans rash, which is basically a rash in the shape of a bullseye target, or a bullseye shape or a target shape, which can be anywhere on your body wherever the tick bites. And this is the most presented in infected people. More than 70% of the people who are infected by Borrelia burgdorferi have this target-shaped rash on their body. And it can grow between 1 inch to about a foot long in area. And some later signs and symptoms of Lyme disease are if you start to develop arthritis, if you have facial palsy, which is basically when one side of your face starts to droop where the other side stays the same. If you have numbness and tingling in any parts of your body, such as your palms or your face. If you have an irregular heartbeat, or if you start to have problems with your short-term memory. So basically, this picture shows that the symptoms of Lyme disease, the symptoms and signs of Lyme disease can be spread throughout your entire body. It can start from your head, it can go to your muscles, it can be in your heart or your stomach. but basically the symptoms are throughout your entire body. And this picture right here shows the erythemal migrans rash, which is in the shape of a target. This is the facial palsy, which shows one side of the face drooping where the other side is not. And this is the swollen knee, which can be tied in with the arthritis and stuff. And this picture also shows that the symptoms are spread throughout your entire body. So the testing for Lyme disease, there are two types of tests that can be performed to know whether or not you have Lyme disease, and it is called a two-tiered test. So for the first test, it is called an enzyme-linked immunosorbent assay, or an ELISA for short. And basically this test detects antibodies to Borrelia burgdorferi. And if you become positive in this test, then you get to move on to the next test. But if you are negative, that means you do not have Lyme disease. And the test number 2 is called the Western blot test, which is basically an immunoblast test. And if you are positive in both of these tests, then that means that the patient is diagnosed with Lyme disease. But if one or the other is negative, then you do not have Lyme disease and you have something else. So treatment for Lyme disease, the Infectious Disease Society of America basically states that you can take antibiotics for treating Lyme disease, and it's only for a short amount of time. So basically you can take oral antibiotics such as doxycycline or amoxicillin, and these are taken daily for about 2 to 3 weeks constantly. And then if you are misdiagnosed or you go untreated and it starts to spread to your nervous system, then you have to take intravenous antibiotics, which is only necessary if it spreads to your nervous system. And this is not recommended because it causes more side effects and symptoms, and it's not necessary unless it spreads to your nervous system. And if you continue to experience these symptoms even after you take your antibiotics, then it is called post-treatment Lyme disease syndrome, and this only happens to like a short or like a small amount of people who do not get treated with the antibiotics. So there are some steps to prevent Lyme disease from occurring. So basically, step 1 is to avoid walking in woody, bushy areas and that have tall grass, because this is where ticks like to thrive the most in. And if you do have to end up walking in this kind of environment, you should wear a long sleeve, you should wear long pants and closed-toed shoes so that they do not have to bite you anywhere in the body. And step 2 is to use tick repellent with a 20% or higher amount of DEET inside it, and this is used on areas of your body which are exposed, such as your palms or your neck. And you can spray this on your clothing as well, so that this drives away any nearby ticks. And step 3 is to shower right after you get back from walking in this type of environment, because if the tick is on you but hasn't bit you yet, then if you take a shower, it is more likely to come off really easily. And then after you shower, make sure you check yourself and you check your children or your parents, and check your pets also for ticks. And these ticks can be really hard to find because they can be as tiny as a pin. As shown in that picture right there, it can be really difficult to spot, so you have to kind of search for it, but be sure to look thoroughly and carefully so that you do not miss it. And if you do end up finding one on your body or on a pet's body, then you should remove it with some tweezers. And these are my resources of where I found all my information, and that is it.